All right, y'all. This video here may be one of the most important videos that I have ever made. And yeah, we cover politics, what's going on the right and the left and all throughout the country. But this video, I'm asking you to pay attention to it because it may save the life of somebody that you love or somebody that you know. That's just how serious this video is, because the Senate just had hearings, and they had hearings on the effect and the impact of the jabs that we were forced to take 2021, 2022 to start with the jab, right? And at this hearing, actual doctors, like some of the most world-renowned doctors with the most experience dealing with the jab, dealing with patients since it started, and the research that went back even further than that, all the way to 2015. In this video, I'm going to show you irrefutable proof of exactly the impact and the effects that they knew that the jab would have on people, how the information was hid or put up allegedly, and also how some of the other jabs that have been mandatory for small children to take between the ages of birth and 18. There are 80 regulatory jabs that they have been putting into the bodies of children, which they now know have been linked to autism, have been linked to the heart disease myocarditis. So I want you to check out this very first clip here, because the Democrats did what they always do. They literally were trying to justify the jab, and they were using all of this fake information saying how it saved lives. These doctors are going to lay out how that is a flat out lie, why it's a lie, and just who and how they tried to cover it up. So this first clip is Democrat Senator Blumenthal. Now, his job is to, stand and try to cheer for the Democrats, and just how this isn't really that big of a deal. So I want just to let you know, before we go into the other clips, I want you to hear what he says and watch what I'm about to rip out there for you next. So check out Senator Blumenthal.
The central issue that brings us here today is the allegation that there was purposeful concealment of knowledge and evidence. And I just want to make the point, I may be sounding a little bit like a lawyer, not a physician, but purposeful concealment, intentional hiding is essentially undocumented by the evidence released by this report itself. In fact, the documents released by the majority today show that public health officials took multiple steps in the spring of 2021 to make healthcare providers aware of those rare reports of myocarditis among vaccine recipients.
Now you heard him try to stress the rare, rare. When he doubled up on it, you already know what he's doing is covering up some BS. And he's talking about, all this information was just given out unprecedented. Yeah, it may have been given out, but what happened to any of the doctors who tried to inform their patients? What happened to anybody who spoke out? They lost their job. They were censored online, but enough of that. I'm going to let Dr. McDullough, who is going to take them to task. We're going to have a couple clips of him. Listen to this man lay out the real. And he is the most renowned doctor on this topic, the most renowned. Check him out and stay with me on this. If you're here because you want to hear, go crazy, this ain't that. The information in this video is far more important, far more vital than anything that President Trump could say today or some ridiculous thing that the Democrats could do. This is real life. And somebody may have taken one of the jabs, may have taken the boosters. So this is what you have to be looking out for and prepare for that could happen to them. Check it out.
The first time I testified at Homeland Security and Governmental Affairs, before a word came out of my mouth, Minority Senator Gary Peters said what America was about to hear was misinformation. I didn't even know what he was talking about. I had never heard that term before in academic medicine or in important deliberations. That's November 19th, 2020. What was he doing? He was using an old communist propaganda technique. He was attempting to gain leverage over me before a word ever came out of my mouth. We should never have our public servants ever try to gain leverage over anyone who is coming to Washington to help the nation on an important issue. As introduced, I'm an internist, I'm a cardiologist. I believe I'm the most published individual who's ever testified on matters related to COVID-19 in any of these hearings. I've seen and examined more patients. I've examined more data, and I'm one of the most published people on the topic in the world. And as a cardiologist, I can tell you, my role in this was to fight disease, preserve life, and above all, do no harm. Do no harm. Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem. There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues. New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection's ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
So, Dr. McCall, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man, just a few days after Pfizer. He comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart.
If you're enjoying this video, do me a solid, hit that thumbs up, because I will never ask you for a cash out or a super chat. You hitting that like button, it helps spread the video out there. And if you aren't subscribed to the channel, subscribe. And whether you're subscribed already or subscribing now, make sure that you hit notifications, you turn on all. YouTube is having an issue with getting notifications out, but when you select all, YouTube will make sure you get notified the next time I upload new videos.
It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine. That's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology. 2 boys, age 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified. They request an autopsy. They call in University of Michigan and University of Minnesota to look over what are they finding at autopsy. Conclusion, it's Pfizer COVID-19 vaccine myocarditis, unequivocal. These are autopsy confirmed cases. So for all the mothers in the room, how would they feel if they found their children dead after taking a COVID-19 vaccine? This is in the peer-reviewed literature. This is not misinformation.
Whoo! Now tell me that he didn't lay it down on him. He definitely did. Took him straight to task. Now, you heard him in that clip speak about Moderna. Now, right here, what I have for you is a clip of one of the executives of Moderna who was being brought up. He was testifying, okay, before the Senate in Australia. And I want you to listen to what he says about the data. And see, that's what's happening. These folks are being brought up, around the world because governments are realizing what happened. Now, I want you to listen to what this Moderna executive says and how terrifying that should be to you. Check this out.
How does your overall rate of serious adverse events compare with routine traditional vaccine products such as flu vaccines and the like?
So I'm not aware of the report to which you're referring.
This is the report of a prominent medical journal. You're not aware of that?
I'm not aware of that.
Do you think you should be aware of that?
I think if you're able to provide that report, then we could provide.
This is part of the frustration of this process. Is if you were here, we could provide you with that. But this has been widely reported. You are a manufacturer of vaccines. I find it difficult to think that you wouldn't be aware of this report.
So one thing I can say is that as a company, we have as part of our pharmacovigilance activities, we do routine screens of the literature to look particularly for publications that include adverse events. We do review those publications and those adverse events, and we do include them into our global pharmacovigilance database. So that manuscript would have been assessed by our pharmacovigilance department, and the information from it would have been taken into account when evaluating the benefit risk profile of our vaccine.
So what is Moderna's overall rate of serious adverse events, and how does that compare with routine vaccinations? Was the question.
I want to give a big shout out to the sponsor of this video, Chapter. And here's why. When my mom hit 65 years old, I watched her get bombarded with mailers, cold calls, and all these confusing ads about Medicare. And every single company pretended like they wanted to help her, but really they were just trying to sell her stuff. It seemed like the game was rigged and she was not supposed to win at all. And that's why I'm so excited to share information about Chapter with all of you. Now, who Chapter is? Chapter is a free Medicare advisory service that compares Medicare plans available, and they give you real unbiased guidance. Chapter is completely independent and always puts customers first. As a matter of fact, at Chapter, the agents are salaried employees, so you don't have any fear or concerns of them trying to work to get commission of some kind. Their whole focus is all about making sure that their customers, the seniors, get the right Medicare supplement plan. And it's clear that they're making a real difference in the lives of seniors. So if you want real, unbiased help with Medicare, give Chapter a call at 402-527-1253. You'll talk to a real person who will help you figure out exactly which plan is right for you. Now, Chapter is totally free and has saved the average senior $1,000 a year. So I'm going to put the number here on the screen for you to be able to contact, or if you visit the website, go to askchapter.org/realpolitics.
I don't have the actual rates of adverse events.
You don't have the rates of adverse events in front of you.
I can refer to the, obviously I can refer to the product information. What I can tell you is that the rates of serious adverse events in our very large randomized controlled trials was actually in a similar range to what was observed in the placebo.
But you can't tell me the rates of serious adverse events. You realise you've come to a Senate hearing today for the purposes of exactly that question, and you can't tell me the rates of serious adverse reactions to your product, which I find extraordinary.
What I can tell you is that on the TGA website, it reports there are 1.2 reports per.
That's the TGA. I'm not asking about the TGA. I'm asking about Moderna. You must have that information. You are a multinational company. You're before a Senate inquiry, and you cannot tell me the rates of serious adverse. I mean, it's quite extraordinary what you're telling me. Nobody can tell me that.
Dr. Clark.
Look at how ridiculous those folks look. The representatives, the executives of Moderna. Now, Dr. McCullough wasn't finished with them yet. Check this clip out as he lays it down again.
You've asked for us to cite evidence. 3 papers by Nathaniel Mead, who's in the audience today, a former National Institutes of Health writer, 3 of them that contain nearly 1,000 references. So they're all there in these papers, have concluded that the risks of COVID-19 vaccination far outweigh any theoretical benefits. We've heard countless wishful thoughts from Senator Blumenthal and from Governor Green, Dr. Green, but they're wishful. They wish the vaccines would have saved lives. They wish the vaccines would have reduced severity. I can tell you, because you know this, I was one of the few doctors who was on the real front lines of treating acutely sick patients at home. That's how we reduced risk of death, not via a vaccine. The marathon runner, he passed away because he didn't receive effective early multi-drug treatment. It didn't matter whether he took a vaccine or not. Our CDC knew about thousands of patients fully vaccinated early in 2021 dying of acute COVID-19. It was abundantly obvious the COVID-19 vaccines did not reduce the risk of death. I don't want America to be fooled by this hearing today, thinking that the vaccines save lives, because they didn't.
Wow. Wow. Dr. McCullough is really putting it to him. And how many times were we told that? Oh, it does this, and people were demonized. I got another clip of Dr. Medulla. He gonna go specifically at Senator Blumenthal right here. Let me let you check this out.
When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't. It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick.
Dr. McCullough is just cooking them now. In this next clip, I'm not sure if you remember, but there was a time where people were talking about using hydroxychloroquine and ivermectin, and they were just destroyed by the media, destroyed by politicians. Oh, it doesn't work. Remember, they roasted Joe Rogan saying that ivermectin was was for horses, and hydroxychloroquine had no impact. Check out this director as she lays it down, the truth about those things.
Was a risk of causing cancer from insertional mutagenesis. We never needed these vaccines. We had treatments that worked. One of our doctors here is going to tell you about that. Hydroxychloroquine and ivermectin, I can tell you as a toxicologist, they are not toxic. They're some of the safest drugs you can use.
Did you hear what she said?
There's no reason once the FDA found out about this contamination, okay, and we looked to see endotoxin levels, but they've got them all redacted. Why would you redact them if you were trying to be transparent? Why would you hold the data for 75 years, all of the clinical data for 75 years from these if you were trying to be transparent? Tell me why.
So as you just heard her say, the FDA had things redacted and it is locked away for 75 years so that the people that are involved, they won't be around anymore because they're in their 40s, 50s, maybe mid to late 30s, some of them, but they won't even be here anymore. So as you're hearing from some of the most renowned doctors, toxicologists, that it was a sham. And I knew that. I myself and my children did not take it. My one son that was in the military, he was forced to. He was forced to do it. But other than that, none at all. My mother, because when it first came out, I already knew what was going on with the previous jabs that they were giving to people. Do you know that they have it where a newborn baby gets a hepatitis B shot? Even though the mother doesn't have hepatitis C, they inject the baby with a hep C jab. Why? And then we're wondering, not to mention that there's many other ones that have no real reason on why it should be going into this child's body, especially a 1-day-old. But guess what? It's been happening. And now autism, which used to be 1 out of every 10,000 children, I believe, or maybe it was 100,000. Now it's 1 out of every 31 children is autistic. That is insane. And this whole surge of it has happened between the last 15 and 20 years. When I was growing up, that was so rare to meet somebody that had an autistic child. Now I literally know 7 parents, and out of those 7, 5 have autistic children. 5. And the parents are healthy people. So it seems. So I just wanted to bring you this news. Like I say, not too much for me to talk on this one because the doctors did the talking. It's best for me to just shut my mouth and let you hear directly from the experts. The next time somebody tries to tell you to go get the jab or the jab saved life, there is no data backing up that the jab saved anything or anybody. As a matter of fact, the 2 things, hydroxychloroquine and ivermectin, were things that I used in my house. We used ivermectin. We had it. And guess what? None of us got hit with it. And so now you got people that went and got jabs, booster after booster, another jab. What is that really doing to the body? And then pay attention to myocarditis. When you see all these college athletes, remember a couple years ago, college athletes and professional athletes were just collapsing on the floor, on the court, and in the field during games. Ironically, they had just got through getting the jab, allegedly, in some of the cases. So I just wanted to bring you this information in today's video to just alert and alarm you. Be careful on what you allow them to inject in your body because these things have mRNA in it. And mRNA does not break down in the body. As a matter of fact, it connects to a cell and produces toxins that go through the body. And guess what's in the jabs? mRNA, allegedly. So I just wanted to bring you that. If you stayed in and you watched the video up to this point, you are awesome. And I thank you from the top and bottom of my heart because you're somebody who really wanted to know what's going on. And tell me what you heard in this video wasn't powerful. And it either reinforces what you already felt or alarms you to what the potentials may be for yourself or anybody else that may have ticked that. But at least you can be proactive. So thank you. If you haven't already, hit that like button. If you aren't subscribed to the channel, subscribe. Most importantly, I want you to stay safe and healthy and be great. I'm Brian Maxwell saying I look forward to seeing you at the top. Over and out, y'all.